All right, we're back on. At this time, we'll invite Fire Chief John Tull. The floor will be yours. What we'll do is you go over your presentation, and then we'll open the floor to each of the council members for any questions or comments.
Okay, well, thank you for this unique opportunity as we use this Zoom meeting schedule. So we really appreciate it and thank you.
This is the first.
Yeah, and hopefully it'll be the last that we won't have to do.
Agreed.
So for our budget, there were several items that we had listed in our essential items, some of which we believe have been funded in our FY21 budget. So we are very appreciative of that. So I'll talk about some of the things that are maybe were not funded in the current budget. The first is we have some issues with our building. There were two concrete repair items that were listed in our essential items. One was the concrete repair sidewalk and asphalt at Fire Station 1 that we are trying to fund out of FY20 budget. So hopefully we'll be able to have funding for that. The other is at Fire Station 16, our back patio that comes off the kitchen is experiencing a sinkhole. So the ground underneath the concrete is failing and it's starting to create a bowl effect where we constantly have standing water on that pad area. So we had asked for $6,000 to repair that concrete. We've had bids done through infrastructure and development with Will White. Had a company come in and they're proposing to lift the concrete with expanding foam to level that out so we won't have that problem anymore on our concrete. The next item that we had talked about, you will recall our vehicle maintenance account had a significant deficit this year in there because of the large amount of repairs that we had to make. Looking back historically, we projected we were somewhere at about $175,000 annual for our vehicle maintenance. We had asked for $75,000 in that account. We were fortunate enough that we did receive $40,000 of that this year or in FY21. Also with one of our accounts is our overtime account. We have historically used our over account and had to transfer money in. Our look back over the last 5 years shows an average of about $112,000 that we spend in overtime. So we had asked for $30,000 in that budget, and we were fortunate enough to get $15,000 in FY21. Two other projects that we had put forward were the creation of two positions. One position we're all very familiar with, and that is the SWIFT position. David Phippen has done a fabulous job in this position, and since its inception has been grant funded every penny of that position. We continue to keep that on the radar for council and the city administration, that in the unfortunate reality, the grant funds run out, the continuation of that program, because it has been so successful and it has touched the lives of so many people that I just would hate the thought of losing that position. So we had asked for funding for that position. And then we had asked for a creation of a deputy fire marshal's position to do several things. One is the workload of the two people in the fire marshal's office is increasing every day. From the inspections, the ongoing construction that's happening within the city, They are being taxed every day. The plans continue to come in. So we're starting to see that additional position is very valuable in that department or that division. And also, currently there is no succession planning. If something were to happen to the fire marshal today, it would be very hard to pick up the pieces and continue at the level that we are now. So the creation of this position allows us to have succession planning in the event that Eric promotes, retires, leaves, whatever it is. We have someone that can continue in that role who's a uniformed position. Then the last thing that we had put forward was the continuation of our career ladder. You recall a couple years ago, we changed our pay scale to change up our job descriptions. After that, we had proposed adding an additional position for a senior firefighter because there's not enough space between the firefighters and the sergeants. So we had asked for this position to be created and funded in perpetuity moving forward. And those were our essential items. You're on mute.
Mr. Boda, sorry.
Thank you, Chief Tall. We appreciate everything our fire department and the services that they provide. I'm in agreement with your essential items. I think the SWIFT position has been an extraordinarily effective role and a great collaboration, and I think it's providing an outstanding community service. So I'm very supportive of keeping that role in that position moving forward. And I agree with the fire marshal. I mean, it's quite a task because you have a lot of places that they got to monitor and inspect, and so I can imagine the workload is not very light. And I think it's always, like you said, it's important to have succession planning and, having somebody in place just in case. So, thank you.
Thank you.
Any other questions about the budget, Mr. Boda? The budget
No,
itself?
I didn't have any concerns. I think
Okay.
done a great job. Thank you.
All right. Thank you. Ms. Jackson, you're up.
I agree with everything that Mayor has just stated. Chief Tall, thank you for your services and pray that you continue to do such a great job as you're doing today.
We appreciate it. Thank you.
Thank you, Ms. Jackson. Ms. Blake?
Hi, good morning. What do you have a number for the senior firefighter position? How much would that start off at?
The approximate cost is about 200 and, I'm sorry, what is the pay grade or what is the total cost to implement that pay grade?
I guess the total cost.
The total cost that we projected is about $276,000.
Okay.
What's the delta over if I could just interrupt, what's the delta between a regular firefighter and the senior?
Oh, so a probationary firefighter would start at $37,500. The senior firefighter would start at $45,56. The senior firefighter paramedic would be $46,396.
Does that help, Angela?
Yeah, thank you.
Okay. Yep.
Yes, it does. I love the SWIFT team. you cannot mess with the results with the Swift team. I mean, they were just phenomenal. You guys do a great job, of course. And thank you for your presentation.
Thank you. And if I could just say something about the Swift position, why I believe it's so important to specifically me is the fact that we've had 2 employees, one David Phippen and 2 Andrew Stanley, who have been in these positions now going on multiple years, and they're living day by day knowing that, am I going to have a position tomorrow? Because if the grant runs out and we have to put David Phippen back on the floor, then that means the person, Andrew Stanley, who's in that grant funded position no longer has a job. So every day they worry about, do I go to work tomorrow or not? And I just feel the job they have done, they deserve to have security and know that their job is safe and moving forward. So.
Anything else, Mrs. Blake? Ms. Blake?
That's it.
Okay. Mrs. Gregory?
I think everybody else covered it. They asked my
Okay.
questions before I could.
Okay, thank you. Chief, I've got a couple of things. Looking at the item detail in the budget. First, let me commend you. I see that overtime for salary part-time is being offset, and now we have a part-time, and you cut down the overtime and paid a new part-time position with that money. That was good. There's been on the LEOPS plan, there's been pretty hefty increase of 62,523, about a 5% increase. And I noticed this on several things. So maybe Mr. Cordry, I can ask this once because I have it in pretty much all the departments. That number and the workers' compensation number for everybody pretty much has gone up significantly. I believe that we're trying to play catch up on the retirement fund, and you can correct me, Mr. Cordry, if I'm wrong. But the workers' compensation, isn't that based on a frequency modification factor? That's for Mr. Cordry, I guess. Keith, are you on mute?
Yes.
Like, okay.
Yeah, can you hear me now?
Yeah.
Okay. Yeah, workers' comp is based on the rates that are that apply to specific categories and also a mod factor. The mod factor this year jumped from 1 to a 1.4. So that's very significant.
So that means there's been more injuries, essentially.
Yeah, there was that injury to the firefighter that was off the
Off the front of the truck?
Yes.
Yeah.
Yeah, that was a big one.
Yeah. Okay.
So that goes citywide. That goes citywide. So that goes against all wages. So we went from a factor of 1 to 1.4. So everything got multiplied times 1.4.
So they don't do it
So
they don't do it by division.
So your mod factor is universal.
Wow. Wow. Okay. That answers that. Thank you, Keith. Chief, landscaping. Is it landscaping? Yeah, I think. Hold on. No, testing. What is that testing number? That went up almost 100%.
That's a new account. So what we did is we took money out of existing accounts where if we pay for annual testing of fire hose, ground ladders, or aerial devices, and historically we have paid for those out of a variety of different accounts. So an attempt to streamline our accounts so we know exactly what accounts and what a cost is. We move money from equipment repair or a vehicle account and moved it into testing to account for those items specifically designed for testing.
Okay. That just makes it, it's a little bit, you know, we've gotten a lot better every year, but this is one of those areas that if you try to compare apples to apples over the
Yes.
previous year, you can't.
Yeah, you should see again on another one called maintenance contracts.
Yeah, that's on there too. I got that. That's a question.
That is, again, we took money out of existing accounts, whether it was vehicle, medical supplies, and that pays for all of our maintenance counts in several areas. One, it pays for the maintenance contracts we have to have for Telewire for all 3 of our buildings. It pays for the EMS to repair and maintenance our stretchers, our power loads, the power lifts that are in the back of the EMS units. Is also the service contract that we have to have on all of our monitors, defibrillators, our Lucas CPR devices, and the annual generator maintenance contract. So these are just all maintenance contracts that we have every year.
Gotcha. So it'll all be lumped, and that's an easier way of looking at it from now on.
Yes.
Okay, great. Good move. And the last question I have is gasoline.
Yes.
What's driving that?
Call volume increase and the increase in fuel, the cost.
Well, we might have an opportunity there based on what's going on now, because there's going to be a glut of glass of oil, I should say, when the pandemic is done.
Yes, they lower the price. Yes.
Okay, so that's an opportunity.
Yes.
That's the last question I have. Thank you guys for what you do. It means a lot. You guys are right on the front lines, and it's appreciated by all of us. And please make sure the guys know that we appreciate it, and we appreciate what they do daily.
We appreciate it. Thank you.
Thank you, Chief. Appreciate it.
Okay.
So Jack, we have the HCD Personnel Committee, Kevin, Shanita, and Corey with us if we want to do them, and then PD is on deck.
Yeah, I saw the chief, so we're okay there. So let's go back to HCD. That shouldn't be bad. So, Mr. Lindsay?
How you doing, Mr. Heath?
Good. Can you introduce who's on the call with you and what department you're in?
Corey Stout and Shanita from HCDD, Housing Community Development.
Okay. The floor is yours.
Hi, good
I
morning.
think Corey and they're going to lead it.
Okay.
Hi, good morning, everybody. This is Shanita.
Morning, Shanita.
Might sound a little muffled with my mask on. Corey and I are here, but we're kind of like 6 feet away.
No problem.
First, we're going to talk about the increase in personal days per year. The city gets 1. The state gets 6 personal days. Board of Education gets 4. We feel that a lot of us use our personal day for mental health days, both code enforcement and homeless services, both. We see things that can be very mentally taxing over time, and it would be nice to have those extra days to use without draining our annual and sick time. And I feel like, as well as other departments might go through that as well, especially like the PD and the fire department. So I think it would be beneficial throughout the city.
Okay.
Right. We're also asking for more money for training. Currently, our department gets $2,100 per year for training, and we have to divide that up between 15 employees in our office, which would equal 140 per person. For code enforcement alone, it is $25 per person for our annual CESOA membership, and another $25 per person each meeting that we attend, and they're required for us to sustain our certifications. We also pay for the ACE membership. Um, as well as exams. Exams are $210 per person. We do lead paint training, and they're $464 per person. And an ACE conference, if any of us would want to go, was $1,800 per person. We also have people who do the flagger training, which is $25 per person. So we would like to increase in that so other people can also be eligible to do trainings and not have to worry about people saying being unable to go because there's no money in the budget for training. We also have a breakdown to show the cost of testing for each exam. I can email this to you guys at the end if you like to see it. I know Mr. likes to have like an actual breakdown. I remember that from last year.
Yeah, if you could send that, email it to us, that'd be great.
Okay, no problem.
Good morning, guys. This is Corey talking here.
Corey. Yeah.
We're asking for an increase in our 457 match. It's currently at 4%, as well as an increase of the annual time or longevity bonus at 25 and 30 years. Right now it stops at 20. So when your years of service hit 25 and 30, you get no more than you did at 20. So a little bit more there would be great.
We would also like to see an employee of the month with a monetary bonus or time off citywide. The monetary bonuses could be like gift cards or different things of that nature. I think that would be greatly appreciated. Also would like to see a birthday recognition day off with pay without using any of your own leave.
On to healthcare, we're looking for some free cleanings at the dentist. Our annual well checks and physicals are no cost to the employee. We would ask that our 2 dental appointments per year are also at no cost. Recognition days are issued with excused sick days. So if I don't use any sick days, I get a recognition day at the end of the year. But if I use a sick day to go to the doctor for a physical or a dentist appointment, and I am no longer eligible for that recognition day. So maybe instead of no sick days being used, only excused sick days. So if I have an unexcused sick day, I'm no longer eligible. But if I have excused sick days, I'm still eligible for that recognition day. Moving on, the option of overtime instead of comp time. Right now, we have no option. It's strictly comp time, and we do a lot of after-hours events, including but not limited to neighborhood walks, Third Friday, National Night Out, movie night, Screen Fest, census counts, Santa's Workshop, right now Camp COVID, as well as the National Folk Festival. It would be nice to have that option to either have overtime pay, at least to a limit, or comp time to be able to make that decision.
Excuse me. Merit-based increases, longevity raises at 10, 15, and 20 years. Also, internal childcare programs. A lot of people have children, and especially small children. I believe as a mother myself, it's good to know that you have childcare available to you. That's a stressor in life. And if you can have access to childcare through your job, I feel like it would be less stress and probably more affordable. And I think that's all we got. Kevin, do you have anything on your end?
Not really. I reiterate, I do understand from our department a lot of extracurricular activities after work, and also the pop-up bus stop. We do that also. You guys didn't include that. And the mental health day, I kind of agree with. I think it's really important. I think that we And I know code enforcement sees a lot and deals with a lot, but I just want to just back up what they're saying in reference to that. But that's it. I don't have anything else to add.
Thank you.
All right, we'll turn it over now to the council with comments and questions. Mr. Boda.
First, I want to thank all y'all for everything you do. I know you guys, you also are on the front lines frequently, seeing things that a lot of people don't see. My question is, because we've had another department mentioned healthcare or childcare provided by the city. So what are the details and the nuts and bolts of that? How would that work? Is this the city actually running a daycare center for the employees, or is this a stipend or a benefit that goes to those who have children in childcare? So that's one thing I would ask, because if the city runs it, there's a lot that goes into it of additional people to run it, liability. So there's making sure that we have the right people who have the proper background checks to be around children. So there's a lot that goes into that. So I would suggest, like I said, if there's a couple of you get together, come up with a couple options, have some cost analysis there on how much it would cost to run the program. And because there's a lot that's entailed with it. I think maybe if there's on switching to the using sick days to go to for a dental appointment or a doctor or a regular physical checkup, maybe I think there should be something in place where if you're going for something that was pre-scheduled, so usually your physical is once a year. Women go see the OBGYN. My wife's appointment is typically a year out. And if the appointment gets changed by a doctor, it's usually 3 or 4 months down the road. So those, I understand, are pre-planned. And I think if you have something in there that is pre-planned and you've requested the day off well in advance, I think, other than a regular sick day is I'm not going to make it in today. I think there's a difference there. And I think that maybe there's something that could be adjusted as far as providing an excused absence for those. So again, thank you all for what you do. And like I said, on the childcare thing, I would say get together, come up with a plan, and we'll go from there. Thank you.
Thank you.
Excellent. Thank you.
Ms. Jackson.
Yes. And Kevin, yes, they did say about the pop-up. They didn't actually call it a pop-up. They called it a community event. So they did mention that part of it. But what I want to say, you want more funds for training. How often are you in training?
So quarterly we do our CEZOA meetings. We don't do any large trainings because of the amount of money that it costs. The CEZOA meetings are more affordable with our budget, but the ones that are really good cost about $1,800 per person. They're usually out of state. That would cost, room and board. So a few years ago, a couple people did go to that, and that's how we know how expensive it was. But with our certifications, in order to do our job, we have to have trainings to keep the certification valid. And then we also have to pay to be recertified. So not only do we pay for the exam, we have to pay to renew it. We have to pay for trainings to even keep it. If just this one portion of the department is using all the training money, it's not fair when other trainings are available to people in the homeless department or in with Kevin's portion of the department. I know they have trainings that they have been to and some that they had to miss out on because of money.
And also, as our department grows, we do have an internal code enforcement specialist with Steve Lowe. And with that, myself, Paul, other employees are helping him. So we're taking chainsaw trainings that we never would have thought we would have had to take. The flagger course. Then we have Kevin's department, trainings that they would need to go to, but we might not have money for. Christine and Joe, I'm sure there's plenty of trainings that they could benefit from. As our department is growing, our training fund is not. And especially with the specialized trainings, they are not cheap. The lead certificate training is very expensive and it only lasts for so long. We have to be recertified every 2 years. And that's not cheap. And that takes a large chunk out of just for the 5 code enforcement officers. That's not including sending Dan or Everett, our superiors with us. That's an extra $1,000 if we want them to have the same experience and training.
So could you actually do the city a favor, the council, and give us a guideline of which ones are more important and which ones are necessary, which ones you definitely need to stay certified?
We can
do that.
absolutely.
And I'm like Mayor on the childcare. If you could get us some information on that, because we did hear it twice, but I think that the first time we heard it was when the other young lady was here for HCDD, and she was Amber was talking about it earlier, and we would like to know, because I do know that is a vital part of employment. And
if the council's willing to entertain, we will definitely bring more information to the table and possibly multiple scenarios to give us options and figure out what has the least risk to monetary benefits.
Okay.
Yes, absolutely.
Certainly will. Thank you for your services. You do a tremendous job in the code enforcement. Kevin, you do a great job as well. And I commend you all and continue to do great for the city.
Thank you.
Thank you.
Yeah.
Thank you.
Andy is on with some details on the childcare if you all want to hear about it now.
Okay.
Hey, everybody. I'm not going to go into super detail, but as you guys know, my background for several years was running the childcare programs for the county, after-school programming, school age from 5 till up to high school. Very familiar with the Office of Child Care and the COMAR regulations when it comes to daycares. One of the things that we were looking at would be to have our own with our own staff. It would be a self-sustaining model. The goal would be to have a sliding scale child care program for our employees. If we could create a break-even budget and utilize some of our already current infrastructure that we have in place, and that's working through our liabilities and some of our offsets of some other costs, because unlike other entities, we don't have to make money off the event. We just need to cover our supplies. So we can put something together, but we are definitely looking for it. The biggest pieces that we have to come up with would be a location to house the child care program, and then how that would impact with staff. And right now we would be looking at something up through that 5-year-old kindergarten. So potentially infants all the way up through 5, up to 5. So that early childhood education component. So we are in the process of working through budgets and working through that process. It's not impossible to do, but I would be helping with some staff. We already have a couple people who are working on putting that together on what that would look like. But again, the big 3 costs is facility overhead, staffing overhead, and then your liability insurances. It wouldn't be that much of an increase to our current insurance policy that we have citywide if we could figure out how to get the facility at a reasonable cost, and then we would hire staff utilizing kind of our current benefits package. We would pass on those costs. I think really important is the sliding scale component. So the people who definitely would need it, this will be an affordable option than what currently exists out in the marketplace. But, again, we're still working through the details.
Thank you, Andy.
Mhm.
Ms. Blake?
Hi, good morning. Can I ask, what would be your, because you gave us a pretty big punch list, which is great. But can you give me your top 3 priorities, the top 3 things that you think you really need to focus on or would need to help your department run?
You're going to have to give us a minute to think about that because my department consists of 4 different co-departments, if you will.
Okay.
If you give me a minute, we can try to put that together.
Sure.
Okay.
Sure, no
And
problem.
maybe I can include that in the email.
Yeah, that might be better. if we got
Good idea.
So we can
Okay.
consult all
Yeah,
departments.
That's a
because
great
we just don't want to talk for ourselves, and then someone be like, "Oh, this is more important to me."
I can tell you what code enforcement wants.
Yeah.
Okay. All right. Thank you so much. Thank you for your presentation.
Of course. Thanks, Angela.
Mrs. Gregory?
So the childcare thing is definitely in my wheelhouse. As someone who operated a childcare facility for 10 years and the 10 years before that worked in them, I really like the idea of having a either one. I think that's an absolute necessity. Either a stipend that goes towards the employees or a facility. There are pros and cons to both. I can say right now, very assuredly though, that what I know of the childcare market around here, it is extremely difficult for families to find care for their kids. So being able to guarantee a spot for a potential employee may make the difference between being able to hire them or not. But if we offer a stipend, they would have more flexibility as to who they could see or who they could go to. So, I can see either one working. I'd be happy to support either one. But I really do like the idea, especially in something to keep in mind with things that are going on right now. A lot of all the child cares are shut down. So, maybe not, ours wouldn't remain open maybe for this particular thing, but having something that would be available for extra hours, because most are only open from say 7:30 to 5. I actually had my center open until 6, and the number of clients I had who needed that extra half hour was making all the difference in the world. So we'd be able to, set the hours and that sort of thing. So that would be a benefit for that, something to keep in mind. But yeah, I'm very glad that this is being talked about because it's a dire need in this area. We're lacking sufficient childcare, especially if you're looking at providing from infant on up. That is, was it 6 weeks to 2 years old, that span, that age group. If you've ever tried to find childcare for a kid that age, it is absolutely difficult because of the staffing numbers. And if we were able to make a break-even model with a childcare that can provide that space for employees, I think that would be a major benefit. So yeah, those are some things that I would say to take into consideration. I'd love to see what plans you guys come up with, though.
Thank you, Michelle.
Thank you.
Corey, thank you guys very much for your presentation. We appreciate it. You do great work. It's amazing that we've turned this whole unit around. by getting out and reaching out to the community, which I think is what we should have done years and years ago. So thank you for your service.
Hey, Jack.
Yeah.
Just, one update. We've been, as you know, tackling sections of the employee handbook, and that's where some of these leave time issues reside. If they, some of them will have a financial component as well, but we have been looking at doing some things with personal days and seeing where we could add those in an appropriate manner. So that's something that will be coming to you in the next. I'm not sure where it resides in the handbook, but you'll be seeing that. And, some of these things, dental cleanings and healthcare costs, anything healthcare has a big ticket cost associated with it. So as much as I think we would, we can certainly ask Jeannie to look into the dental cleanings and stuff, but I'm not sort of hopeful that those will be a realistic request at this point, unfortunately. So I just wanted to share that feedback. Anything healthcare is just so expensive and the costs are going up. And what we have been doing a good job is educating our folks on, when to use certain levels of the healthcare system, avoid the ER because it's an expensive correlation that resides on the city as well as the individual. So training our folks to use the healthcare system appropriately, we will continue to reduce our costs. So then hopefully we can do some things differently. But it's just, as you know, a systematic challenge, and it's tough.
Thank you, Julia. Well, it's 10. Thank you very much again, folks. And please get the message out to your people that we appreciate what they do.